Welcome to the Africa Public Health Podcast from Africa CDC, your go-to source for information on key continental health security issues. I am your host, Andisiwe Michelle May. In this series, you will get valuable insights from African scientists and researchers as we unpack important public health topics that impact the continent and the latest developments in public health research. In this episode, we delve into the role of emergency preparedness and response in strengthening health security across Africa. We are joined by a medical epidemiologist and leading expert in public health emergency management.
My name is Wessam Mankoula. I'm the Regional Director for North Africa Regional Coordinating Center in Africa CDC, and I'm also serving as Acting Head of Emergency Preparedness and Response Division in Africa CDC.
Dr. Mankoula reflects on key moments from his educational and professional background that have led to his current role and inspired his mission to improve healthcare for all people through developing policies and programs targeting disease prevention and control.
Graduated from School of Medicine. This is back to 2007. And graduation from School of Medicine give you the experience, how can you be patient-centered and focusing on bringing the people back to health from disease. But after graduation, 3 years later, I joined Field Epidemiology Training Program, which is focusing mainly on epidemiology, strengthening surveillance system, and also fighting epidemics. And this shift from patient focus to community health, this was important shift for me, because I felt during this time that just fighting disease among patients is not enough to bring healthy communities. So healthy communities need more focus on public health aspect. I had the opportunity to join Africa CDC since 2016. I was one of the first 10 epidemiologists that joined Africa CDC to support establishment of Africa CDC, building a continental public health agency. It was important experience for me to witness how Africa CDC started from small room within African Union Commission now to this fascinated, not only big building within Addis Ababa, but also how it evolved and grew as continental agency, shaping the public health for Africa. When I joined Africa CDC, also I had the opportunity to join the Public Health Emergency Management Fellowship in UCDC Atlanta, which gave me also another dimension related to emergency management, establishing Public Health Emergency Operations Center to manage information and resources to respond to various emergencies. I think I had a good opportunity to navigate between having governmental experience, working for the government, and also working for non-governmental organization, and finally joining international organization. Starting my career with government within Ministry of Health of Egypt as epidemiology and surveillance officer, then joining also communicable disease department. Working for the government gave me the opportunity to know what are the challenges that faced within the government, what are the opportunities, what are the threats. So this is currently also helping me how to navigate and build a healthy relationship with our government colleagues, because you understand the context, you understand the challenges that they are facing, and also the opportunities and threats.
Thank you for sharing your remarkable career journey with us. Turning to your current impactful work that you're involved in at Africa CDC, how does the organization coordinate emergency preparedness efforts across the continent, particularly in North Africa, where you have extensive experience?
I think this is an important part as a continental agency, especially when you are working in a continent like Africa. We're reporting more than 150 public health emergency on a yearly basis. Almost every week you have 3 emergencies happening in the continent. So coordination and leading the emergency preparedness and response, this is one of the important roles that Africa CDC is playing. And to enable us playing this role, I can say that we have what is called three triads framework. The first triad that is focusing on approaches and intervention. The first element focus on early detection. We have amazing surveillance team work 24/7, scanning the internet on a daily basis, communicating with our member states to collect information about various public health events happening in the continent. And once they pick signals related to potential public health emergency that may happen in the continent, or also potential public health emergencies that is happening outside of the continent and may have impact on us in the continent, they start working on verifying those information through communication with focal points from ministries of health, from the governments, from different international organizations. Once we verify this information, then we start working on initial risk assessment to identify the magnitude of this risk. This happening within the country, include multiple countries, it has a potential to spread to multiple regions. So this is the first element, early detection for various public health emergencies, not only happening in Africa, but also happening outside of the continent and may have impact on us in the continent. Second element of this first triad is focusing on prevention, mitigation, and preparedness. How can we work to prevent emergencies from occurring? But some of emergencies, we may not have the capacity to prevent them. If you speak about hurricanes, cyclones, some of those environmental challenges, you may not have the capacity to prevent them. So we're working with our member state to mitigate the impact of those emergencies. Then working on preparedness element. How can we strengthen the preparedness capacity of member states, of our regional offices, of our continental headquarters here in Africa CDC? Working on this preparedness element, this include risk assessment part. How can we identify the risk, assessing this risk, and measuring the potential of various threat and hazard to spread beyond the border of the countries? Supporting our member states to have their multi-hazard, multi-sectoral preparedness and response plan, not only having the plans to prepare and respond to various emergencies, but also testing those plans to identify what kind of gaps that they need to work on. And under preparedness element, also working to strengthen the logistics and supply chain management capacity at different level, at country level and also at continental level. We have a logistic hub here in Addis Ababa. We used it during COVID-19 response to distribute various commodities and supplies to our member states. We managed during this time, if we have any commodities and supplies, we need to distribute it to the member states. Within 5 days, we can reach the 55 member states with the key commodities and supplies needed. The third element of the first triad is focusing on the response part and recovery element as well.
Are there any critical tools or systems that you use when coordinating responses to public health emergencies?
Within the emergency division, we do what is called grading part. Once we pick signals related to an event and we verify this information, we do what is called grading. And we have within Africa CDC 3 levels of grading for various events. Grade 1, this means that this event within the country and the country have the capacity to respond to this event. So our rule as Africa CDC, keep close eye on this event, closely monitoring the situation, and keep reassessing this situation. Grade 2 event, this means that this public health event involve multiple countries within the same region, or it has the potential to spread from one country to another within the same region. In such case, we have our regional office, our emergency operations center at regional level. We activate our emergency operations center at regional level to coordinate the response within this region. Grade 3 event, this means that this public health event involve multiple regions, or it has the potential to spread to multiple regions within the continent. This is when we activate our emergency operations center at continental level. So this is a grading mechanism to coordinate and the lead response within the continent. This is the first triad about the approach and intervention. Second triad, focusing mainly on enabler aspects. Let me start with the first one of those enablers, governance element. When we speak about the governance, we are advocating for having incident management structure This is unified command and control structure to lead and control and coordinate the response to various emergencies. This can be happening at country level, regional level, and continental level. Second element for the enablers is the partnership. We believe in the importance of the partnership, but we need this partnership to be action-oriented. We don't need just talking, but we need to walk the talk. So having action-oriented partnership, having partnership based on mutual respect between us and different partners. Third, enablers focusing on sustainable financing. Emergency is costly, and respond to emergency need a lot of resources. So we need to continue working at different levels on sustainable financing mechanism, having also domestic financing. The third triad in this framework is focusing on the level of intervention. So all those approaches and intervention that I mentioned, all those enablers, we need to have them at the three levels: country level, and second level is the regional level. The third one is the continental level. So this is the three triad framework that is governing our approach for coordination and for the response and preparedness to various emergencies in Africa.
Touching on the importance of partnerships, from your perspective, where do you see the greatest need for collaboration in strengthening Africa's public health systems, and what kind of partnerships are valuable in addressing these needs?
One of the key challenges to have quick access to the data coming from the member state. And if we speak about country level, quick access to information coming from subnational level to national level. This will not happen without having indicator-based surveillance, having event-based surveillance at all levels within the country, within the region, and within the continent. So this is one of the challenges. And it combined with these challenges, digitization aspect, to ensure you're not only having access to the data, but having timely access to the data, and not only timely access to the data, but timely access to quality data. So digitization element and digital initiative, this is one of the flagship projects for Africa CDC and for His Excellency Director General of Africa CDC, this digitization and digital initiative to enable us to have quick access to data coming from the member states. When we speak about surveillance system, strengthening the laboratory capacity as well, because we cannot believe that we have powerful surveillance system without having powerful lab capacity, because this is what helps us to confirm the different threats and different pathogens occurring within the continent. And when we speak about the lab capacity, we cannot forget the growing importance of genomic surveillance as well. Start grabbing the attention, showing the relevancy and growing its importance during COVID-19 part. I think there is an important point here we need to take it in consideration. Collaborative surveillance and having one health approach in mind when we speak about surveillance part. I think we cannot ignore while we are speaking now in 2024, having the surveillance for human disease try to be integrated, work on integration with surveillance for animal diseases as well, and also for environment. You cannot start protecting human being just from the border of the human being. We need to expand our protection zone, starting from animal health and also going to the environment as well. As you may know, 75% of diseases, emerging and re-emerging diseases, reported in the last 3 decades, 75% originated from animal. So if we need to protect human health, we need to start from animal health, we need to start from the environment. And climate change, this is one of the greatest challenges of our days today. So we need to keep close eye on the impact of climate change on human health as well. So this is why the idea of collaborative surveillance and having one health approach important in this aspect. Then before leaving the surveillance part and detection element, I think we need also to start thinking about some sort of paradigm shifting. most of the member states, most of the organization looking for disease surveillance. But I think this is the time now to shift from waiting for disease to happen to be more proactive and doing what is called risk surveillance. We are tracking the risk, keep eyes on the risk. This risk may be outbreak happening in animal health. As I mentioned, when we speak about the environment part, flooding crisis happen. So we don't need to start our surveillance system from the disease when it attack human being. This would be too late. Then the third element that we need all our partners, we bring all the effort to work together on, the response element. And this response element can include having one of the initiatives that we have is AVOC, African Volunteer Health Corps, including Rapid Response Team and Emergency Medical Team, and also having Public Health Emergency Operations Center up and running in all our member states. This is one of the key targets for us. We believe that this Public Health Emergency Operations Center, this is the house to keep close eye on potential public health emergencies that is happening in the continent. And once it occurs, the Public Health Emergency Operations Center should be leading, coordinating the response to those various health threats. This can frame the key areas that we are currently and also in the future will keep working with different partners to address such needs in the continent.
Could you share examples of recent partnerships or collaborative initiatives that have significantly impacted public health?
The Public Health Emergency Operations Center, because we believe this is also one of the success model that we have within Africa CDC about the importance of the partnership and how can partnership push important agenda like the Public Health Emergency Operations Center forward in the continent. We conducted a survey back to 2021 to map what is the status of Public Health Emergency Operations Center in Africa. And we have standardized questionnaires distributed among all our member states to ask them about the status of the Public Health Emergency Operations Center. And during this time, when we start asking in the first question in this questionnaire, the result was really interesting. When you start asking member states, do you have a national functional Public Health Emergency Operations Center up and running? Around 41 countries mention they have their national functional Public Health Emergency Operations Center. Then we start moving from this introductory questions to do more deep diving, asking about the critical components that ensure the functionality of the Public Health Emergency Operations Center, similar to infrastructure element, workforce development, access to data, different policies, plans and procedures, domestic financing for the Emergency Operations Center. Then when you start doing this deep diving and asking more detailed questions to get real understanding for the status of the Public Health Emergency Operations Center, then remember we started 41 countries mentioned they have their national functional Public Health Emergency Operations Center. After putting all those elements together, then we found that only 12 countries meeting 80% of the minimum requirements for the functionality of the Public Health Emergency Operations Center. So this put some pressure on us about the importance, how can we work together to strengthen the capacity of the member states. When we speak about the Public Health Emergency Operations Center, this is not a boardroom, this is not a meeting room, but this is a whole big concept, require infrastructure, people well trained about responding to various emergencies, having policies, plans, and procedures in place, and people trained on those policies, plans, and procedures, having access to commodities and supplies required to respond to various emergencies, having access to the information that will enable you to know what is happening within the jurisdiction of your country or region or the continent, and also enable you to take appropriate, quick decision to respond to various emergencies. So in 2018, we start by building a coalition for Public Health Emergency Operations Center. We found during this time, a lot of partners, they are investing in Public Health Emergency Operations Center in Africa, but unfortunately, each one working in silo. And during this time, you may find one of the country receiving double or triple support from different partner organizations. while others, they are not receiving any support. So we started communication with different partners, and we managed, since then to date, to have within this coalition for public health emergency operation center, WHO at all levels, WHO Afro, EMRO, HQ, UCDC, UK Health Security Agency, West Africa Health Organization, Robert Koch Institute, Resolve to Save Life, European CDC, Bill and Melinda Gates Foundation, and other partners. All those partners came together to agree we are sharing the same vision. We are looking for strengthening public health emergency operation center in Africa. Let's put all our efforts, all our resources together and move ahead to strengthen this agenda. Last year in 2023, we launched joint strategy, one strategy to guide our work to strengthen the capacity of public health emergency operation center in Africa. One assessment tool by all organizations, one training material. We are conducting trainings jointly together. Even we developed the first African roster of experts. One roster of experts. This is for African experts. We can use them, deploy them to support member states to establish their public health emergency operation center. One roster of experts developed by all partners and used by all partners. And building on the strength of Africa CDC, as we are the continental public health agency that is embedded within African Union Commission. So we wanted to use the power of African Union Commission. So in collaboration with His Excellency President Hakainde, President of Zambia, back to 2022, we called for meetings on the sideline of Lusaka Summit, the mid-year summit of African Union. This is for heads of state and government to discuss only one agenda item. How can we strengthen the public health emergency operation center in Africa? And one of the main outcomes for this was having Lusaka call to action signed by all our heads of state and government. And all our heads of state and government committed within the coming 5 years to have national functional public health emergency operation center in all our member states. And tasked Africa CDC to lead the coordination with different partners to ensure achieving this commitment from our heads of state and government. So we believe this is one of the good model that we manage through the collaboration and partnership with different organizations to start pushing this agenda forward. We are planning in 2025 to repeat the survey. Then we measure the progress of the implementation of the Public Health Emergency Operation Center in Africa.
It's evident that a lot of effort goes into these well thought out systems, and you have just painted a very encouraging picture for us. We've spoken in depth about the role that regional and international partnerships play in addressing cross-border health threats. Can you speak on some of the recent key events that were significant for Africa CDC?
There are two most famous quotes during COVID-19 time. Each one keep repeating during COVID-19. The first one, diseases have no borders. Everyone keep repeating this. And second, no one is safe until everyone is safe. So these two quotes give a lot of attention and importance for the importance of this cross-border collaboration between different countries. However, we need also to be frank. This cross-border collaboration is coming with data sharing element. And this data sharing element, we saw during COVID-19 unpleasant experience and huge challenges when one of our member states, let me speak about South Africa, when they reported Omicron, they were very quick. This is one of the most advanced surveillance systems, especially pathogen genomic surveillance system that we have in the continent. Country have powerful surveillance system, quickly detect this new strain of Omicron, and they have the courage to share the information publicly to protect the global, not only Africa, but the whole globe, raising this warning about this new Omicron that is coming. But what was the result? What was the outcome? For one of the countries have the most advanced surveillance, have the courage to share the information quickly. We found some of the countries start blocking their borders, not only for South Africa, but for all the people coming from most of the South African member states. So this is sending a bad message about data sharing element. What message we are sending by taking such unilateral decisions that is not based on science? Then later on, some of those countries start realizing that they already have Omicron reported in their countries. So I think this is one of the challenges that we need to be also open when we are discussing this data sharing element and cross-border collaboration part. But for us, we are pushing for this cross-border collaboration between our member state. Let me speak specifically about North African region. At the beginning of this month, we organized a cross-border collaboration workshop in Libya for member states from North African countries. Member states came to discuss how they can move forward with sharing information among the countries of the North, and also how can they collaborate with each other when emergency happen, to share also some of the resources, maybe financial resources, human resources between the countries in the North. So we're moving in two directions: cross-border collaboration between the countries within the same region, but also, as you know, that many of the countries in North Africa, they are sharing border with other countries from other region. For example, Egypt sharing border with countries from East Africa, Libya sharing border with countries from also East and Central Africa. We have Mauritania sharing borders with countries from West Africa. So we'll be moving in two directions: cross-border collaboration within the country, within the same region, and also at country level, how can we also ensure cross-border collaboration between each one of those countries and the neighboring, either within the region or from other region. So this will be the issue that we'll continue working on with our member states.
You were one of the leaders in Africa's response to the COVID-19 pandemic. And throughout the series, we have spoken about how the pandemic tested all aspects of health systems. I would love to hear from you what lessons from Africa CDC's response are being applied to current and future emergency preparedness.
This is one of the important issues that we faced as Africa CDC, and one of the biggest challenges that we faced during this time. It's almost 4 or 5 years since establishment of Africa CDC. Then you are facing such a pandemic. I think one of the critical and challenges during this time start raising the questions and make us questioning globalism versus regionalism. And we believe during this time that we had a big issue when it comes to global health security. I believe that there was a failure in global health security infrastructure during COVID-19 happened. And while this global mechanism was failing to support countries in the global south and developing countries, it arise the important role of having regional public health agencies similar to Africa CDC that can play a critical role in ensure coordination, solidarity, communication, collaboration between member states. Because it was challenges to get access to some of the key commodities and supplies needed to respond, especially at early days of this pandemic. So moving from globalism versus regionalism to the second challenge is equity and access to critical commodities and supplies needed to respond to such pandemic. Equity in distribution of those key commodities, if we speak about vaccines or different tools related to responding to COVID-19, this was a big challenge. Africa, unfortunately, stayed at the end of the queue to get access to COVID-19 vaccines. Some of the countries, they have double and triple their needs of COVID-19 vaccine, keeping those vaccines, while Africa doesn't have timely access to those key commodities. And during this time, this was a unique position for Africa. During this time, we were not looking for a donation for COVID-19 vaccine. We managed through one of the mechanisms that we established during this time, AVAT, African Vaccine Acquisition Task Team, to secure resources in cooperation with Africa Bank. Around $2 billion was allocated and ready to start procuring vaccine and make this vaccine available to our member states in Africa. However, with the resources that we have, we were not able to get timely access to the needed vaccines required to vaccinate our population in the continent. So equity and having timely access to the key commodities required, was one of the important challenges. And as I highlighted earlier, the unilateral decision by some of the countries in Europe and America related to data sharing element when South Africa shared data about Omicron part. So this unilateral decisions. So this some of the challenges.
As we move past the challenges, can you share some of the success stories and ways that Africa CDC is strengthening systems and building resilience after the lessons from the COVID-19 pandemic?
Let me try to frame them in 3 areas. The first one about the governance. This is the first time the continent come together back to 15 February 2020. And this is almost 1 week after the first case reported in the continent. So we managed to call for emergency meeting for the health ministers after the first case reported in the continent, and bringing all the ministers to discuss having one joint continental strategy for COVID-19 response and establishing AFCOR, Africa Task Force for COVID-19 Response, as a continental structure for coordination, collaboration, and communication between our member states. And this continental structure, starting from at the top of this structure, heads of state and government that meeting regularly to give strategic guidance for Africa CDC related to the response. We have ministerial committees, one for health ministers, one for transport and logistics ministers, and one for the finance ministers. Then we have a steering committee, and we have different technical working group to address the technical areas related to COVID-19 response. So this was a governance structure to coordinate the response to such pandemic. And the way forward for us, how can we move from this COVID-19 specific coordination structure to have standing coordination structure for all public health emergencies? And now also with MPOX, we start testing a new model for having one IMS structure that coordinate the response for MPOX with one plan for all partners and also one budget. So this is some of the model that we will be also working on the coming period related to the governance of emergency preparedness and response in the continent. Moving from the governance element to the finance part. During COVID-19, we established COVID-19 fund to get access to resources, either from the member states, from private sector, from international partners, from different governments. So we established this COVID-19 fund to help us to mobilize the necessary resources to respond to COVID-19. And now we are moving from COVID-19 fund to emergency response fund, having standing fund within African Union, and this is the resources will be used to respond to various emergencies, not only COVID-19. And also, during COVID-19, as I highlighted, we established a VAT mechanism, African Vaccine Acquisition Task Team. And through collaboration with Africa Bank, we provided local financing to procure key commodities, such COVID-19 vaccine. Moving from the finance element to the third part, system and capacities. Local manufacturing. We cannot afford to face a new pandemic without strengthening local manufacturing, following this huge lesson learned that Africa stayed behind. Africa didn't wait at the end of the queue to get access to the COVID-19 vaccine. This is one of the flagship agenda for His Excellency Dr. Kaseya about strengthening local manufacturing. And when we are speaking about local manufacturing, we're not speaking about vaccine only, but also we're speaking about therapeutics, we're speaking about diagnostics. Second element under system and capacity is access. And as I highlighted, we established during COVID-19 a VAT mechanism, African Medical Supply Platform, and now we're building on this success stories to establish African pool procurement mechanism to start using the same model to procure commodities on behalf of our member states based on the needs of the member states and make this access with cheap prices to our member state related to various commodities and supplies. And last element under system and capacities is the coordination and collaboration. And as I highlighted, we believe the Public Health Emergency Operations Center will be the hub at country level, regional level, continental level to coordinate the response. This is why we're working following Lusaka call to action to strengthen the capacity of our member states and even our headquarter emergency operations center to respond and coordinate the response to various emergencies.
As you mentioned, COVID-19 came with its challenges, but it also provided opportunities. Can you share insights into Africa CDC's recent responses to health crises like the Mpox outbreak?
For Mpox response, as I highlighted, with COVID-19, we learned a lot. We started developing different mechanisms that we can use for future emergencies. And also are looking for improving. We started with a coordination mechanism, as I highlighted, AFCOR, Africa Task Force for COVID-19 response. Now we're moving toward having one incidental management structure. This is to lead the response to this continental health emergency, the Mpox one. So with this one IMS, we're advocating for having one team, which is this incident management structure team, include not only Africa CDC, include WHO, UNICEF, UCDC, all key partners involved in the response and would like CEPI would like to contribute to the response to this Mpox. So having all the key partners within one response structure. And after forming this one response structure that called by Africa CDC and WHO to have one plan. We have one strategy that is guiding the response of all key partners related to the Mpox, not only in DRC, but for the whole continent. So starting with one team, this one team worked to develop one strategy and one plan to respond to this continental outbreak that is happening in the continent, and having one budget. Instead of having different resources, each one keeping his own resources, how can we map all the resources that all the partners have? Then we start sharing those resources and use those resources to coordinate our response and implement this strategy. So this is the new model that we are currently adopting when it comes to Mpox response. Having one team, one plan, and one budget, and one M&E. Also keep monitoring and evaluating the progress with the implementation of those response plan. So this is one of the way forward from the model that we adopted during COVID-19 to now the Mpox part. And while we are testing this model and adopting this model to coordinate our response to Mpox, there are many areas we were taking note about the importance of investing jointly in collaboration with different partners in. As I highlighted, surveillance and disease detection. This is one of the key elements. We need to continue invest in collaboration with different partners while we are responding to various emergencies. We need to make use of the opportunities of having those emergencies and having resources available to invest in strengthening surveillance and disease detection capacities in the member states. This also should be tied with the lab capacity and decentralization. I think each one of us heard recently about this mysterious unknown disease that reported recently in DRC. This unknown disease showed the importance of working on strengthening lab capacities and decentralizing those lab capacity. It will not be acceptable in the coming period to have good lab capacity at central level, but at subnational level, we don't have those capacities. So to transfer sample from these far areas to central level, you need maybe 4 or 5 days. Then you have risk of those sample are spoiled, are not following the necessary measure to keep those sample valid for testing. So lab decentralization, this is one of the critical elements. Risk communication and community engagement. All this misinformation that started with COVID-19 and continue with various emergencies to address them, we need to strengthen our risk communication and community engagement capacity. Public Health Emergency Operations Center, our target during this time to strengthen Public Health Emergency Operations Center at national level. But once we are done with this agenda, we need to start looking for having also the Public Health Emergency Operations Center at subnational level. Especially we have some of the big countries having only the Emergency Operations Center at national level will not be helpful. If we speak about Nigeria, maybe one province in Nigeria has a population similar to a population of other countries. If we speak about DRC, very big countries, some of the challenges related to roads and infrastructure. So having only emergency operations center at national level, this also will not be helpful in the context of DRC. So moving the coordination aspect from national level to subnational, this will be also one of the agenda for the future.
As we move towards the end of this discussion, let's zoom out for a second and look towards the future. What is the vision for Africa's health security, and what steps are being taken to ensure sustainable health systems and preparedness for future generations?
Our future vision as Africa CDC, it's summarized under what we are saying the new public health order in Africa. And this new public health order include 5 critical elements. The first one, strengthening continental, regional, and national public health institutions. This is a critical element. We need to strengthen our public health institution at national level. This is why we are pushing for all our member states to have their National Public Health Institute or CDCs, where all the critical functions of public health to be within one institution. And those critical functions include surveillance, include public health laboratory, include public health emergency operations center, workforce development, and research element as well. So we are advocating for all our member states to have their National Public Health Institute. This is within the national level, regional public health institution, and continental, similar to Africa CDC. This is one. Second, workforce development. Strengthen our human resources. Even if you have good institution, good infrastructure, resources, financial resources, without having the human cadre that is well-trained and have the vision to strengthen the public health capacity within the country or the region or the continent, we're not able to move anywhere. So investing in workforce development, this is one of the critical elements. We have within Africa CDC multiple training programs for our member states. We are launching lots of fellowships. One of them, Kofi Annan Fellowship, for example. This is to strengthen the leadership in public health in Africa. We launched also Africa CDC Public Health Emergency Management Fellowship. This is to strengthen the capacity of experts from member states in Emergency Operations Center and emergency management. Other fellowships coming related to pathogen genomic sequencing and Africa Epidemic Standby Force. So this is different training program and fellowship to strengthen the workforce development in the continent. Third element, local manufacturing, as I mentioned, including vaccine, therapeutics, and diagnostics. This is health security of the continent. And we cannot afford to continue without strengthening and building those capacity within the continent. Third element, domestic financing and sustainable financing, having those different resources through adopting innovative method for mobilizing resources and depending on local resources to support responding to preparing and responding to various emergencies in the continent. Last element, but not least, is the partnership. And as I highlighted earlier, when we are looking for partnership, we are looking for action-oriented partnership and partnership based on mutual respect. So those are the 5 key elements that is shaping our vision for the new public health order in Africa.
In closing, I would like to shift slightly and ask a more personal question. The work you do is both demanding and impactful. How do you balance professional responsibilities with personal well-being to maintain resilience and focus?
I think this is a tough question. Really, keeping this work-life balance is becoming very tough. Especially also recently, I'm leading two main responsibilities: the regional coordinating center as a regional director, plus the emergency as well. And let me say something. Following COVID-19, I believe we start moving from work-life balance to work-life integration. And this is very tough, having Zoom calls all the time. I think we're only missing having Zoom calls while you are sleeping. But now with this kind of Zoom calls, Teams, you become accessible all the time, not only during the working hours, but also when you are returning back home. This has become very tough to move from this work-life balance concept to work-life integration, because now you will not find the clear borders between work and life with this model after COVID-19. I was discussing with some of my colleagues. If we start moving from work-life balance to work-life integration after COVID-19, I think this should be raising alarm. We need to think, how can we return back to work-life balance? Otherwise, we may continue for more extreme area to work integration. Then the life will be all the time about work. Let me mention some of the tools that I'm trying to use to try to keep some of the balance. The first one, prioritizing self-care. Try to have some boundaries and have some times with the family, even if I'm away from the family for engaging in various emergency. And especially dedicating some times related to celebration of key milestones for my daughters, for example. Second is delegation and team working part. Delegating some of those responsibilities to the team working with me. It's important not only for me to have time for balancing between work and life, but also to build the capacity of the team work with me. When you are empowering them, ensure that they are moving on the right track, achieve and deliver the task assigned to them, and build their capacity to be future leader for the organization. Then the third element is focusing on continuous learning, and through engagement in different leadership programs within Africa CDC. For example, I had the opportunity to join one of the exchange program between Africa CDC and Robert Koch Institute, and this focusing on developing a global leader for public health. So being part of those leadership programs to make you inspired and make you resilient, I think this is also an important element to make this kind of balancing.
Whether you're an expert in the field of public health or simply interested in learning more, the Africa Public Health Podcast is here to serve as a reliable resource for you. Please get in touch at africacdc.org. Until next time, I'm Andisiwe Michelle May. This is a Volume Podcasts production.